Hi, welcome to my physiotherapy video site. I'm your host, Brett Wade. The videos contained in this site are for general interest and not meant to replace medical advice or related treatments. Always speak with your family doctor or licensed healthcare practitioner prior to starting any exercise or intervention. One of the most common chronic injuries or problems that I treat is sacroiliac or low back pain. The back pain usually comes on slowly and eventually leads them to their doctor or their physiotherapist who maybe sent them for an x-ray. This x-ray often would show degeneration of discs in the joints of the spine, as well as the joints surrounding the vertebrae. None of this ever surprises me, and what people don't know is that many of the times their low back pain started with stiffness of the hip or early degeneration of the hip joint. The usual course of history prior to the person complaining of low back pain is difficulty doing things like putting on their shoes or socks. This person has long given up daring to sit on the floor. When a person loses the ability, usually due to not doing mobility exercises regularly, to do activities effortlessly like put on shoes or socks or sit cross-legged on the floor, at first they will naturally keep trying. And while that's a good idea to keep your hip joint and all your other joints quite vital and mobile, forcing them to move too far, too fast can create much bigger problems in the hip and the surrounding muscles and cartilage, and of course in the neighboring joints as well. I've watched people in the clinic bend forward to untie their shoes, and when that hip joint stops at 90 degrees or the shape of an L, they will still push it and try to reach those pesky shoelaces, and in the end usually end up by spraining ligaments in their low back. This can lead to degeneration of the joints in the low back as well as in the spine or discs themselves. So let's quickly look at the anatomy of the hip and what can be done, or not only to help your hip function and your ability to put on your shoes and socks, but to help with low back pain that you may be having or may want to prevent. Firstly, the hip is one of two ball and socket joints in your body, the other one being up in the shoulder. Ball and socket joints are designed to permit a wide range of motion to allow us to accomplish activities like sitting on the ground and putting on your clothing, walking, playing sports, and reaching all the way up to the top of the shelf to find the cookie jar. As with any joint, the ball and socket joints of the hips are surrounded with a joint capsule. And a joint capsule contains a fluid and makes a fluid, a very slippery fluid, to decrease the friction of the joint. It also bathes the cartilage to help keep it healthy. All this works great if you do take your hip joints through their fullest range of motion every day, but many people don't. Once you stop doing this, taking your hips through full range of motion, or any joint through full range of motion, they do tend to stiffen up over time, and the cartilage starts to wear down, leading to more stiffness and pain. Likely the first thing to happen is a shortening of some of the key muscles around the hip, especially the hip flexors, the hip rotators, which are deep beneath gluteus maximus, taking that off, as well as the hamstrings and the adductors or groin muscles will tend to get tight and stiff. This will prevent you from being able to take your joint through full range of motion, but naturally you're going to still want to try. And this, of course, as I've said before, will tend to lead to excessive strain on the areas of the low back as well as the discs in the back as well. So the goal is to maintain and even possibly improve some mobility and some range of motion. Now, we're not going to be able to reverse all of the degeneration that's happened, or maybe even any of it, But if we can gain a person a few degrees of range of motion in their hip joints, it will take a lot of stress off the low back. The key to gaining range of motion is to gain it back slowly with regular practices that take the joint, in this case the hip joint, through its full range of motion. So if you're ready, let's get started. To begin, start to warm your hips up by doing some hula exercises. Take your hips and swivel them one way, and slowly swivel them the other way, about 30 times in each direction, trying to make smooth circles. For this pendulum exercise, put about a 5 to 7 pound ankle weight around your lower leg. Swing your leg like a heavy pendulum back and forth about 30 times in each direction. Then begin to swing and make small circles, 30 times one direction and 30 times the other direction. Remember to keep your leg heavy. Try not to use muscles as much as allowing the weight to carry the leg. Finally, begin to cross your leg back and forth, also about 30 times. For this hip flexor stretch, come to half kneeling. The leg that you want to stretch is the kneeling leg behind. If you have balance for it, bring your arms up into the air to also experience a fascial stretch. Hold for 30 seconds. To stretch your quadriceps, steady yourself with the chair. Bring your foot that you want to stretch back towards your bum. Hold for 30 seconds, and then extend the knee backwards and raise the opposite arm in the air to add a fascial stretch. Again, hold for 30 seconds. Standing with your feet greater than hip distance apart, bend one knee while stretching the inside muscles or groin of the other leg. Hold for 30 seconds, then bend the opposite knee, stretching the other side of the groin muscles. Again, hold each of these stretches for 30 seconds. Seated in a chair, cross one foot over the opposite leg. Allow that ankle to rest just above the knee. You should feel a stretch in the hip, just deep into the buttock area. Hold this stretch for 30 seconds before gently releasing that foot and then doing the same on the opposite side, crossing the opposite leg to rest on the other side just above the knee, and again holding for 30 seconds. By doing these exercises for your hips on a daily basis, not only can it improve your ability to do activities like taking on and off your shoes and socks, but it will help to relieve some of the stresses, both on your low back and also on your knees. Remember that all your joints need to be moved through their full range of motion every day. This keeps the cartilage and surrounding tissues like ligaments, as well as the joint capsules and fascia, healthy. If you don't use the range of motion that you have, you will lose it. I hope you have found this video helpful, and if you have, please feel free to give it a thumbs up and subscribe to my channel. I have many more videos on my page that are not only physiotherapy related, but also meditation, yoga, and some general health ones as well. I wish you well on your journey. Peacefully, Brett.